So now we'll talk about pulse, which is the force that's created by the left ventricle, and every time that the heart beats, it creates a wave pressure that can be felt as a pulse. A pulse rate would be how many times your heart beats in a minute, and you can check that. I've marked in my arm, and I'll show you guys. Right here, right on the middle of the arm, if you touch your pinky to your thumb, you see a tendon that sticks out right there. And then the other tendon right on the side, if you palpate to the side, if you another tendon right there, the radial artery would be right on the side of the second tendon. So if you let go of your finger and just relax, you can feel your pulse right there, right by the side of the second tendon right there. And also you cannot use your thumb because the thumb has its own heartbeat. And for an athlete, the heart pumps 30 quarts of blood per minute, which is a lot of blood because their oxygen supply is a lot higher than of sedentary people. Also, the heartbeat creates the lub and dub sound. The lub is the systole of the atrium, so that would be as both atria contract, the opening and closing of the atrioventricular valves make the lub sound. And then dub would be the systole of the ventricles, and as the ventricles contract, the opening and close of the pulmonary vein, the pulmonary valve, and the aortic valve would cause the dub, would result in the dub sound. So here's how the electricity in the heart happens, and we get a heartbeat. We have a node which is made out of special fibers that can carry electricity. And this fiber, as it gets charged, it will send electricity on the back of the heart on this direction to the left atrium. It will send electricity on this direction, which is the right atrium, and also sends it down here to a second node, which is called the atrioventricular node. And as it sends these signals, this direction and that direction, the electrical signal, it will contract both atriums, and the blood will be pushed down. At the same time that it is sending the signal to this two atrium, it's sending down in the ventricle in the atrioventricular node, but this signal, it reacts it in it's a little delayed, because if both chambers would contract at the same time, then blood couldn't be pumped. So even though the signal is sent here at the same time it sends to both the atrium, both of the atria, it delays a little bit before it sends out its own signal. So now we have both of the atria in contraction. And then what happens is, as the blood is passed to down here, the atrioventricular node contracts and sends its electrical signal here on the septum on a special little piece of fiber, and this fiber runs just like this, the way up this way and up this way. So what happens is, when the atrioventricular node sends electrical signal down to the septum and to the myocardium of both ventricles, it will contract the ventricles and send the blood up to the lungs and up to the brain and body. So where does lub and dub come into play? Lub would be sending the electrical signal. So this lub, dub, lub, dub, lub, dub. And that's where we get our pulse from. But how can lub and dub be translated into a graph so when we go to the hospital they can see if our atria is contracting correctly, or if the ventricle is contracting, or if a valve is not working properly? So we have what they call the EKG or the ECG, which stands for electrocardiogram. And the electrocardiogram, it keeps track of the energy, the electricity being transferred in the heart muscles. So an EKG kind of looks like this, with a really big peak. Just like that. Okay, so right here is a different color. Q, R, S, T, and P. What P stands for is atrial systole. What the QRS complex stands for is ventricular systole. And what T stands for is ventricular diastole. And here would be the area that would show atrial diastole. So just as the heart cycle and the way blood flows, it all connects to each other. The way lub-dub happens, how the electrical signals will conduct the heart muscles to have a synchronized pump. It all translates to this figure right here, because first the atria will contract. That will push blood to the ventricles. So as this is happening, atrial systole is happening, ventricular diastole is happening. So as the atrium pushes the blood down to the ventricles are relaxed to receive the blood. And then after the ventricles receive the blood, they contract, which is this whole cycle. So after as the ventricle contracts, the atria is being relaxed so blood can fill in again. So it's a closed system, and there's no air bubbles, and blood is always flowing. And the last thing that we'll talk about for this section of videos is cardiovascular disease, and they're usually referred to as CVD. And I'll talk about the risk factor and then just name some of the diseases, but I think it's important for you to maybe write this list down and then go back to your PowerPoint and fill it in, because I would just give a couple words about each disease, but I'm not covering everything. I'm just letting you know what could possibly be on your exam. So the risk factors are family history. So if somebody had a heart disease or died of a heart disease before 55 years old, that's probably a red flag that you should check your heart, if it was your mom and dad or grandpa or uncle even. Or it could be a genetic predisposition, which is kind of the same thing. If it's on the family, it will continue to be on the family. Also, it can be what kind of lifestyle you're exposed to, if you exercise or don't exercise, if you're a smoker, eating habits. All of that can increase your risk for cardiovascular disease. And then also another risk factor is to be a male, because males have increased risks for CVD. So a sign of low blood flow in the heart is called angina, and that's just chest pain that will happen when somebody's doing something that their heart is working really hard. So let's say that somebody with a cardiovascular disease is hiking, or it's helping somebody to move in, or even running or anything like that can cause angina, and that is a sign of that the heart muscle is dying because it has no oxygen. There's also medication that you can take for that as an immediate mediation for the blood flow to be short, but you still have to go to the doctor because it's very dangerous. So look it up in your PowerPoint and make sure that you know what medication and what kind of surgery you can do to alleviate angina. Also, there are some diseases. Hypertension, it's increased blood pressure, and normal blood pressure is 120/80. 120, the higher number in this case, is always the systole, and 80, the lower number, is diastole. So every time you say my blood pressure is 90/60, it means that my systole is 90, my diastole